when Dr. Keita Curry asked me to MC this, I jumped at the chance because it's another opportunity to speak out. And it is my pleasure now to introduce Dr. Curry, the president and CEO of Didi Hirsch. Recently, Keita was honored by the Los Angeles Child Guidance Clinic. They described her as a shining visionary and an audacious advocate. From Reuters to the LA Times to MSN, Money.com, reporters regularly seek her out for interviews. Her staff will tell you that she also does math in her head, not I've got to see, and has the tenacity of a terrier. I think when it comes to this cause, it's more like the tenacity of a pit bull myself. Although Keita has a lot on her shoulders, you know, she has 350 employees and there are 40,000 people. Think about that, 40,000 people that Didi Hirsch helps each year. She always makes time to ask you if you need help. So may I please have a nice, warm welcome for Didi Hirsch's fearless leader, Dr. Keita Curry.
Thank you. You've all heard of Tennessee Williams, right? Yeah. Well, like a character in one of his plays, my Uncle George lived with my grandma his entire life. My mother didn't hide the fact that he'd been molested by the local doctor, and she let us know that her father had accidentally killed his own brother while they were hunting. And when she was a divorcee and dating, ooh la la. But you know, when she died, I found out that she had a selective memory. I was sitting with the relatives, and we were talking about Uncle George, and they said, well, you know, he had schizophrenia. Was I shocked, because I thought all the mental illness came from my dad's side of the family. But you know, now it's been 60 years, and there are so many effective treatments. Gone are the days of lobotomies and the Thorazine shuffle. Yet still, there's so much secrecy when it comes to schizophrenia. We avoid it the way people used to avoid talking about cancer when they thought it was a death sentence. It's not a healthy strategy. When we don't talk, we leave the news media to create truth. And if I'm a terrier or a pit bull, they're buzzards. Thanks to all the airtime that the news gave the Unabomber and the shootings at Virginia Tech, most people associate schizophrenia with violence and despair. But actually, people with schizophrenia are 12 times more likely to be victimized. And people with schizophrenia are living managing their illnesses instead of their illnesses managing them. Speaking of managing, you have an opportunity to manage the politics of mental health on May 19th. There's going to be a measure on the ballot. It's Proposition 1E. It would allow the state to raid mental health services, and it would set a precedent, a dangerous precedent for the future. In 2004, you may remember that we passed the Mental Health Services Act that seemed like the first time we would actually have enough money to serve everyone that needed us. The services that we started with were those for the homeless and those who were cycling in and out of hospitals and the jails. Over 200,000 people have been served now, and Didi Hirsch is proud to be one of the providers involved in that program. We serve hundreds of people, and half of them have schizophrenia. Sometimes they come from the jail in the middle of the night, and sometimes they come to us wearing nothing but a hospital gown. I can't tell you what a joy it is to see them transform. What a joy I felt when I saw the woman I first met sleeping in the doorway of our center, now looking for a job. And with this program well on its way, the next step was going to be to fund prevention and early intervention services. But that's not going to happen if Prop 1E passes. The state wants to take $500 million from the Mental Health Services Act. $500 million, and I said take, not borrow. And it's just false. I know that you might read this, but it's false that the funds will create new services for children. The money will let the state off the hook for for services it has provided for years because the court mandated it to. So please take some materials that are in the back about Prop 1E before you leave, and please remain committed to erasing stigma. An awful lot of us have had ADHD, OCD, PTSD, or something else clouded in stigma, and it doesn't cost a penny to tell your story. You don't have to get up on stage. You can start by telling one person, and I'm going to give you a chance to take a step right now. Whether it be a friend, a family member, or yourself, if you know someone who has schizophrenia or a similar disorder, would you please stand and remain standing for a moment? Wow. Now, if you know someone, anyone that has ever suffered from a mental illness, and there are a lot of them, remember, anxiety and so on, would you please stand? You can see that we're the majority, so keep telling your stories. Thank you.